on my channel Doctor's Desk. So today we'll have Dr. Sanjeev. He's gonna share his journey while clearing his UPSC CMS 2021 exam. He got 109 rank in UPSC CMS 2021, and he also got 163 rank in NEET PG exam. So he's gonna share his journey and about the UPSC CMS exam. Hope all of you gonna enjoy this video. So before starting the video, I'm really thankful to Dr. Sanjeev. So let's hear him now.
Good evening everyone, myself Dr. Sanjeev Jindal. I have done my graduation from GMC Patiala. I would first of all like to thank Dr. Sagar for giving me an opportunity to share this platform of the Doctor's Desk. I have currently achieved the rank of 109 to UPSC CMS, and I would really thanks to everyone who supported me in this journey. And I would briefly like to describe my journey of the UPSC CMS. First of all, what is UPSC CMS? It's an exam which is conducted by the UPSC every year for the final year students as well as the interns. Everyone can give it. So you can give it even in the final year. The exam is conducted in 2 sets from 10 to the 2. It's conducted in 2 shifts on the same day. So basically it's a 4-hour exam in which the medicine and the secretary or the ENT part are covered in one. And in the other sec 2, which is covers the surgery and obs, gynae and anesthesia. So the better description is given on this Doctor Desk channel by the Dr. Sagar Push. So you should really watch that. It's really helpful. What was the journey or you have to prepare for it. The preparation is nothing different. Whatever you do for your profs or the final prof, it's the same. It's based on your clinical postings, and the preparation for the NEET PG or the notes are totally same. So you don't have to prepare something separately. So all you need to do is just give it the 100% to your final prof exams and clinical postings, and it's the level of its toughness is just the multiple choice questions are asked more in this UPSC CMS as compared to math based questions which are more asked in the NEET PG. So you should better do all the previous year questions from the UPSC site which are more frequently asked, like from the pediatrics about the development milestones, or of the anesthesia about the different gases. So you should cover those topics more. In fact, the detailed description of all the topics are given in the curriculum of the UPSC. The rest about my journey, I just did prepare what I was preparing for the NEET PG. The same notes I read for the UPSC CMS, and I gave the UPSC CMS in November 2021, and the interview was conducted in the June. It was conducted in the June to September, and my slot was in September. In interview, the main things was about your hobbies. They asked about the detailed application form. They asked about your hobbies or the different clinical postings or the different activities you have done during your MBBS. And more thing that mattered in the interview was your confidence. With what confidence you speak and with what determination or clearly you answer the questions that were asked. And you never had to stop. Basically, the questions asked to me was about the neonatal resuscitation, about the Ryle's tube, or about the preeclampsia, eclampsia, or the TB activities, the World TB Day, in which I participated, the theme of the World Health Day, and all the clinical related questions, or what I described basically in my DAP was about the travel. So they were asked me about the different medicines that I would carry if I am going to travel somewhere else, the basic medicine kit or the first aid kit that requires, which medicines would be included in that. So there is the Railways Ordinance, Municipal Corporation, and the Municipal Corporation and CGHS, of which I opted for the railway. About the detailed description, you can watch Dr. Sagar Push's videos on this. In fact, it's a great Group A officer's job which provides you 6 months training in the Vadodara, in Gujarat, about the railways. And it's definitely a great job which gives you the opportunity to in fact complete your NEET PG after your post-graduation, after joining the UPSC. So you can give, in fact in railways they give you even after 1 year the chance to join the NEET PG. You can give it and join the post-graduation and then back come to the UPSC again. So it's a great opportunity. Everyone should in fact be aware about it. In my college, very less students were knowing about it, and they couldn't even They couldn't give it because they didn't know about this exam. So I just wanted to share this platform more about this exam, that how it's conducted, when it's conducted. Most times it's in the June when its application forms are out, and it's conducted by November due to COVID. It's little late running this year, so you must attempt it, and in fact you can give it along with your NEET PG. I applied coincidentally in the same year. In the November there was UPSC CMS, in March there was the NEET PG exam. In this year in NEET PG I cracked it with a good rank of 163, All India rank 163. The rest, what I just wanted to share with the experiences, that just be consistent, keep revising the same notes. It's nothing different. You don't run about the difficult. It's the basic things, the clinical postings, the clinical approach towards the questions, and the confidence. Basically, that's what you need. It's always a consistency. It's always your revisions, and the basic thing is just don't simplify the things, the basic knowledge or the clinical knowledge that you would apply while seeing the cases. Basically, you need to treat the patients, not mug up the information. It's how the way you will treat a patient when the patient is in front of you. It's not about the mugging up, just getting up the knowledge. So it's how you will apply it. So run behind the knowledge or behind how you will apply its applications. Thank you.